we go.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, folks. This is Jay Nichols, Child Care of America. I'm joined by my colleague, our health and nutrition expert, Krista Scott. Wanted to thank all of you for taking time from your schedules to join us for this little webinar we put together on child nutrition reauthorization, as well as other issues such as with regards to the child and adult food program. As with many previous webinars, as Director of Government Affairs, I will lead off with just a brief introduction. Obviously welcome everyone to the call, and then I'm going to in just a moment hand it off to Krista to take it from there. Just want to very quickly, these are usually some frequently asked questions for all these webinars. The first one is, yes, this is being recorded and it will be on our YouTube page probably no later than tomorrow. The slides will also be published on our website, on our public policy page. For those of you that may have any questions, we don't have a lot of folks participating on today's call, but if you do have a question, we strongly encourage you to utilize the chat feature that you'll notice on the right side of your screen. Just type in if you have any question, and Chris and I will do our best to answer it for you. So with that, I am going to hand it off to Krista, and Krista, take it away.
Thanks so much, Jay. Hi, everyone. It's so good to be with you today on this beautiful Wednesday. I hope that you had a fantastic May Day, and if you're anything like me, you're probably surprised that we're already in the midst of May. I'm really pleased to be here today to talk to you about child nutrition reauthorization and some of the rules that are coming out, either proposed rules and some recent rules that were passed about the child and adult food care program. A lot has been happening with USDA and child nutrition, so hopefully this will just give you a sense of what's happening, what the discussions are on the national level, and I'll direct you to a resource and a webinar that can help you know more about upcoming changes that centers will need to make in regards to the revised CACFP meal patterns. I want to also say that I want to thank FRAC. We work closely with FRAC, the Food and Research Action Center, in the health and nutrition world. They are the experts and leaders, and I'm thankful to Jerry Henchy for letting me use her content and slides on part of this presentation. They had already done the work, and I felt like it would be kind of a shame to try and dilute the work that they had already done. So we're partnering with them to bring you some of this content today. So here's a look at what we're going to talk about. First, we're going to talk about child nutrition reauthorization with a focus on CACFP. If you know of other provisions, say the summer meals program or WIC, and you have questions about that, at the end we can discuss that. I don't have slides on it, but I'm happy to talk with you about what's going on with these reauthorization bills and those programs as well. But please know that I am not a specialist in those other programs, so I only know the highlights. We're going to talk about the Senate bill and talk about the House bill, talk about the differences and the concerns and recommendations we're making as it relates to child nutrition reauthorization. We're going to then talk a little bit about some proposed integrity rules that talk about really sort of the monitoring and oversight of CACFP. And last but not least, we're going to talk for just a moment on the CACFP meal pattern changes. And I'm going to direct you to a FRAC and USDA webinar that's happening next week on that. And I anticipate that we'll have an opportunity for questions and discussions. So child nutrition reauthorization, what do you need to know? First and foremost, this is the reauthorization that immediately comes after the Healthy and Hunger-Free Kids Act of 2010, which you may have heard of. And so this bill comes out approximately right on schedule. CNR is scheduled to be reauthorized every 5 to 6 years. The Senate Agricultural Committee is responsible for coming up with their reauthorization bill, and they did, the Improving Child Nutrition Integrity Access Act of 2016. And in the House, it's the House Education and Workforce Committee, and they put out the bill Improving Child Nutrition and Education Act of 2016. So those are the two bills we're going to be talking about today. So first we'll talk about the Senate bill. So the first provision that we very much like about the Senate bill is it allows an additional snack or the option for an additional snack or meal for children in care for 9 or more hours a day. And the idea is that it's designed to support new, healthier meal patterns, and that the additional snack will be phased in first to family child care providers and then centers. So that's one big change with the new reauthorization from the Senate bill. Second, and this is, I think, going to be really good and critical for providers, is that the reauthorization bill simplifies eligibility for-profit child care centers by extending current certification periods. So what this means is centers with a high percentage of low-income children, either 50% or more low-income children, will only have to recertify every 6 months, and then other for-profit centers will have to do it every 2 months. That's drastically reducing the amount of paperwork that's done on a monthly, quarterly basis for child care centers. The bill also includes nutrition education for parents and participants. And what I really like, of course, thinking with my nutrition and healthy habits hat, is that it requires there to be an emphasis on the relationship between nutrition, physical activity, and health, which is going to be really good when we're trying to make sure that children enter, start out in life with a healthy weight and healthy habits. Back to the paperwork reduction. It reduces paperwork for parents, providers, and sponsors by directing the USDA to streamline and consolidate paperwork and record-keeping requirements, including reducing burden of applications, monitoring and auditing requirements, eliminating unnecessary and duplicative federal and state regulations, and helping them and ensuring that they're maximizing use of technology. And they're going to do this by putting together an expert advisory committee that will look at the existing systems and structures and to make recommendations on how they can streamline so that it's an easier program to navigate, so it's not as burdensome to implement. The other result is that the USDA must issue guidance or regulations within 1 year of the date of enactment to implement any changes. So they can't drag their feet on this. They have to act within 1 to 2 years on this issue. Another area that I think is going to be really great for providers and sponsors is it requires the USDA to review the CACFP serious deficiency process and issue guidance that helps everyone understand what a real serious deficiency is, so that people are understanding why they're getting written up, why they're getting cited. So it requires them to review it and do a comprehensive review of key areas, including mediation and state-specific requirements. According to the bill, USDA guidance should establish parameters for a consistent appeals process to review a finding of serious deficiency, which is great. This allows providers the opportunity to have a formal and clear process for getting their serious deficiency reports reviewed and adjudicated in a timely manner. It also allows for sufficient time for family child care providers to fix a corrective action item. So it standardizes the process so that there isn't just an immediate rush to move forward on a violation without ample time to address it from a family child care provider's perspective, which we think is going to help create some more fairness and transparency to the system. The other piece of the guidance that I think is really important is it requires the USDA to offer clarity on the different measures of noncompliance to reduce the number of providers who are sanctioned for unintentional program violations. Right? I think what it's going to do is it's going to require them to have better criteria for serious deficiencies that are willful versus accidental, and offer a little bit more opportunity and leeway for there to be some coaching, hopefully, on and not penalizing people for errors of omission, for example, or mistakes versus actual critical problems or willful violations. Stepping away from the serious deficiency process requirements, just another thing the bill does is it allows residential child care institutions to participate in CACFP instead of the school meals program should they choose. It's an optional. It doesn't require them to participate in CACFP, but it offers an element of choice. and they can pick the food program that works best for them and the children in their care. Finally, it expands eligibility for CACFP to schools operated by the Bureau of Indian Affairs, which is very exciting. Also, I think this is going to be great is for SDA to announce meal reimbursement payment rates and income eligibility guidelines by February 15th. Right, so there's an element there that'll be a little bit more consistent for planning purposes. But there were some things in the bill that were unwelcome surprises to those of us advocating for program streamlining that supports providers and for increasing access to meals and snacks to children who most need them. First is that we feel that there are some unnecessary budget requirements. The new law, or the bill requires sponsors to submit a budget report describing expenditures and the amount of meal reimbursements retained by the organization for administrative costs. We see this kind of extra paperwork and overburdensome to providers who already struggle with the amount of paperwork that they're doing. One thing that we also are not thrilled with is that it eliminates CACFP startup and expansion funds. And the biggest surprise and the biggest barrier is that after this bill passed, the COB report came back and said that the bill cost much more than was expected, and while this bill is highly favored by the administration, they are looking at that snack and looking at it, at stripping it for cost savings. And we really feel that the snack is a very important piece of the bill, so we are advocating for them to keep the snack. However, some key messages to the Senate. One, we appreciate the bill. Thank you very much for it. We encourage them to maintain the provision allowing providers to offer the additional snack for children in care for long hours. Again, these are children in care for 9+ hours. And little tummies, little snacks throughout the day. They need that meal. And they might be going home to nothing. So that extra snack is really going to help make sure that they're achieving the amount of calories, the amount of vitamins, nutrients that they need to stay healthy. We want them to remove the unnecessary budget reporting requirements for CACFP sponsors, and we'd like for them to restore the CACFP startup and expansion funds. So that was the Senate bill, and moving on to the House bill. One, straight out of the gate, the House bill did not have the extra snack provision. So already not looking very favorable from our perspective. Second is that it allows for-profit centers to document institutional eligibility every 4 months instead of every month. This is similar to the provision in the Senate bill, so we are in favor of this, although we would prefer the Senate 6 months instead of 4 months. But all in all, we do appreciate the attempt to reduce the amount of paperwork and busy work in documenting eligibility every 4 months. This bill actually provides a carryover option for organizations sponsoring child care centers and after-school programs in CACFP, and this is not in the Senate bill. There is a mandated review of paperwork requirements similar to the Senate bill. It also requires a review of the CACFP serious deficiency process with guidance to assure a clear and fair system. This is the provision we also support. Same as the Senate, it allows residential child care institutions and Bureau of Indian Affairs schools to participate in CACFP in lieu of school meal programs. But it also has the unnecessary reporting requirements, submission of the budget report, the amount of meal reimbursements, et cetera, and it eliminates startup and expansion funds. It also connects CACFP state agency options to draw down and spend additional state audit funds between 1.5% and 2% to working with other state agencies involved with monitoring and institutions. Which is interesting because these funds are crucial for state agencies to provide effective support and oversight for new healthier CACFP meal patterns, including site visits, which are so important. One thing in the House bill also that we are concerned about is that it creates a new requirement for all CACFP program findings to be turned over to HHS, right? So there's a concern there about what HHS would or could do with this data. And we anticipate that knowing this, some providers may choose not to participate because it could jeopardize their relationship with HHS, either with CACFP or with other programs, with child care in particular. So we are not in favor of this provision. Although we understand that it is an attempt to share information and provide a level of oversight on bad actors, we ultimately believe that it will actually have an impact on program participation in a negative way that outweighs the benefit of sharing information. So our key messages to the House: when the bill goes to full committee, it needs to include the extra snack, and it needs to eliminate the provision requiring findings to be turned over to HHS. We feel that this bill is unacceptable because it doesn't have enough done for CACFP. We think that school meals verifications and community eligibility provisions, which are things that we didn't talk about, but we can talk about if you have questions about them, are going to damage access to school meals. And we see that this bill will also roll back school nutrition standards, in addition to what it does to CACFP. So I don't see any questions. If you have any questions, that's the overview for child nutrition reauthorization. Before I move on to program integrity proposed rules, does anyone have any questions about that? Go ahead. Yeah, I don't see anything in the chat box, sorry. Go ahead and type them into the chat box. Okay, seeing none, I'll move on, but please, as things come up, or if you remember a question, go ahead and type it in. The Child Nutrition Program Integrity Proposed Rule does a couple things. One, sorry, maybe I should give a little background. The idea is to provide a little bit more guidance on the monitoring and oversight pieces of CACFP. So the first thing it does is it establishes fines or assessments against School Food Authority or others that are administering child nutrition programs, including CACFP, if they fail to correct severe mismanagement, which includes the ability for USDA to fine the state agency. So, for example, if provider A consistently violates in a particular area, the state agency has the right to fine that provider for that violation over time. And if they consistently fail to meet that requirement and the state cannot manage to get that provider under in compliance, the federal government can fine the state for failing to properly administer its oversight responsibility. So that's one thing that the integrity rules do. Second is it defines disqualification procedures as voluntary and non-voluntary. I think you might be familiar with non-voluntary disqualification, right? That's if you have enough various deficiencies that you are no longer qualified to provide CACFP or other child nutrition programs. It's also adding a definition of voluntary disqualification, which would mean that either the program participating or the government or the federal or the state agency could decide that the program will no longer be a participant without it being due to any without cause. The third is state agency sponsor review requirements. It requires developing review criteria from the state to programs that account for risk management of problems, which I think is a good thing. It provides a clear definition of what deficiencies would be and how the state plans to deal with them. This proposed rule also makes the state liable to pay for all valid claims for reimbursement from non-federal sources if a fair hearing timeframe is not met by the state. So if a provider asks for a hearing and the state doesn't meet its timeline, then the state is on the hook for paying any valid claims that happen during the period of time in which their hearing is not held. It allows the department to increase the amount of audit funds available to CACFP state agencies if it can use them to improve program management. And finally, it expands disqualification list so that if you are on the disqualification list for one child nutrition program, you are barred from all of them. So there are a couple pieces of this proposed rule that stand out for us that we're concerned with, and it's related to the state agency's ability to terminate permanent agreements for convenience. We feel that this has the potential to negatively impact vulnerable populations at the convenience of the state. I'm thinking specifically about remote or rural populations, because in the proposed rule it states that for whatever reason, including hardship or difficulty, the state can terminate an agreement. So you can imagine if the state has budget cuts and it's difficult to review or to do visits to a particular population or provider, it could opt to use this voluntary termination for its convenience, which would mean that provider is no longer a provider to some of the more vulnerable populations, rural populations. And also, I mean, if there are issues in urban areas too, where the state feels like they do not necessarily want to or have the capacity to have oversight in a particular neighborhood, they would have the authority to do so. We think that this could reduce the participation in CACFP and leave many children and families vulnerable to hunger. So we are not in favor of that proposed rule, that piece of the proposed rule. However, we do appreciate the attempt to create parity in the level of oversight between affiliated centers, unaffiliated centers, and family child care homes, and having some risk-based monitoring programs and principles which reward those who are doing well with less administrative burden. Part of the proposed rules states that monitoring systems should take into account past performance when scheduling their oversight of the program, and we think that that's a great idea. Don't forget to chat your questions if you have any. But I'll move on just briefly to the revised CACFP meal patterns that were finalized in April 2016. I know we've been waiting a long time for that. And they'll be in effect October 1st, 2017. The major takeaways, the first thing I'll say is that the revised meal patterns that are going into effect are a great compromise. There were lots of concerns from providers about the cost of implementing some of these changes that came out of the IOM report that was used to form the basis of this meal pattern. Some of the recommended changes, like limiting meats to certain days, having a rainbow of vegetables and fruits on your menu, were seen as a little bit difficult and challenging to implement, both from a feasibility and provider training and area, but also in terms of cost. And so because they needed to take into account cost and ability to implement, as well as health and nutrition and best practice, what we end with is a good mix of the two, I think. A couple of the highlights. The infant meal pattern has changed, so it requires whole vegetables and fruits to be served as a snack for infants 6 to 11 months of age. And it eliminates fruit juice from the infant meal pattern. I think those are the two big takeaways. For the child 2 and up, 1 and up, it establishes a separate vegetable component and a separate fruit component. That was one of the big changes that we were looking at. So you can no longer interchange fruit and vegetable. They have separate components now at lunch, supper, and snacks. It limits the serving of fruit juice. I know there was a lot of discussion about whether fruit and vegetable juice is going to be banned completely or just limited, and so it limits the service of fruit juice or vegetable juice to 1 serving per day for children 1 year and older. It requires at least 1 serving of grain a day be whole grain rich. So that, that's another one of those compromises. Instead of 100% whole grain or every grain being whole rich, at least 1 serving of grain a day needs to be whole grain rich. And the definition of that is hotly debated, and I'm sure there will be specific guidance coming out on that. Finally, it disallows grain-based desserts from counting towards the grain requirement. So you can no longer serve, say, a cookie at snack and be reimbursed in order to meet the grain requirement at snack. Again, this does not prevent anyone from serving a grain-based dessert. It prevents them from getting reimbursed through CACFP. I wanted to let you know it's going to be a really great and in-depth Healthier CACFP Meal Standards webinar done by FRAC and the USDA coming on May 9th, 2016. We'll have information about how to register on our website, but I wanted to put this up here for you as well so that you had access to it. We think that's going to be a great resource for you. You're going to hear it straight from the USDA's mouth on how it's going to get rolled out and what next steps are going to be taken both from them and from other advocacy organizations. And now I will open it up to questions and discussion, if any. I don't see any in the chat box. Going once. Okay. Well, I thank you guys so much for your time today. I hope this has been a helpful brief overview of what's going on in the world of child nutrition programs. I encourage you, if there's specific resources, I want to make sure that you have access to them, so you can please email me. I'm usa.scott@usa.childcareaware.org. You can find my information also on our website. And I'm happy to answer any questions or provide any resources you need. Thanks so much.
Thank you, Krista. And of course, you may, if you have questions for me, as always, I'm available. And my email again is very similar to Krista's, j.nichols@usa.childcareaware.org. I want to thank all of you for your time. Strongly encourage you to participate in next week's FRAC and USDA webinar, and we hope you enjoy the rest of your week.
Yep. Happy May, everyone. Thanks so much. Bye.